Abortion Law Reform Amendment, Healthcare Access Bill, second reading.
I call the member for Newtown.
I move that this bill now be read a second time. Thank you, Speaker. It is my absolute pleasure to be here in the chamber to introduce the Greens Abortion Law Reform Amendment Healthcare Access Bill 2025 on behalf of indeed the Greens, and I want to thank my colleague who's in the chamber and a colleague in the other place, Dr. Amanda Conn, for bringing this important bill to the Parliament. 6 years ago, with so many, I was very proud to be a co-sponsor of the Abortion Law Reform Act 2019, which finally decriminalised abortion in this state. Even then, we knew that at that watershed moment, that it was only the first step, a step of many, and indeed not the last. And I am pleased to see that we are now taking the very next and important step in this chapter to ensure the work being done, or the work done to decriminalise abortion, indeed is followed through by ensuring that all people have access to that critical health care. Because while abortion was removed from the Crimes Act in 2019, and even as we were passing this critical reform to decriminalise abortion, we knew that legislative reform wasn't ever going to be enough on its own, and that ensuring access was a critical part of this. No one knows the negative impacts and issues that arise from access more closely than those who are seeking to provide this healthcare to people in regional and remote communities. And that is why it is so powerful that this bill was carried, developed and introduced by the Greens member of the Upper House, Dr. Amanda Conn, who during the 2019 debate around decriminalisation joined other healthcare practitioners in Wodonga to write an open letter to the New South Wales government outlining the cross-border disparity in access to abortion and urging them to support the land reform. The group wrote, "We ask that you similarly allow colleagues and our patients the freedom to make these choices safely in their own communities and without fear of persecution." Despite these calls, when we pass the long overdue reforms to decriminalise abortion, there are still, sadly, vast swathes of the state in which people cannot access this vital health service. Only 3 of the 220 public hospitals in New South Wales consistently and openly provide abortion services. Rural and regional communities disproportionately bear the brunt of this inconsistency, with people in these areas forced to drive hours simply to access their right to choose. Last year, the Sydney Morning Herald reported on a woman who became pregnant 6 months after a caesarean and developed a life-threatening pulmonary embolism. She was only able to access the care she needed at Westmead Hospital after being turned away by 4 private clinics after waiting weeks for an appointment and being quoted several $100s for the procedure. The same report highlighted the story of a single mother of several children who had sought an abortion immediately after discovering she was pregnant at 10 weeks. After waiting weeks for the available appointments at a community-based provider and being initially quoted $700 for the care she required, she was not able to get an appointment in a timely manner, at which point the cost of the care she required had risen to $2,000. It took over 2 months for her to access the abortion care she needed at a public hospital. When reporting from the ABC and The Guardian revealed the scale and prevalence of barriers to abortion access in New South Wales, there was widespread outrage and concern in this place and beyond. The Greens knew then, as we know now, that that outrage alone, without action, was never going to be enough. And that is why today I am so pleased to be able to bring this bill to this chamber. What this bill seeks to do is as simple as it is consequential. It would allow nurse practitioners and endorsed midwives, highly trained, highly skilled, professionally qualified, essential workers in our public health system, and indeed in our health service in this state, to prescribe medical abortions. This will have an immediate major impact on access to reproductive justice, particularly in regional and remote communities, where many struggle to get an appointment with a GP or indeed cannot access the healthcare that they require. To enable this change, Schedule 1, Clauses 3 to 5 expand the class of health practitioners who may perform termination on a person who is not more than 22 weeks pregnant to include prescribed health practitioners defined as a medical practitioner, an endorsed midwife, a nurse practitioner, or another registered health practitioner as prescribed by regulation. It is worth noting that Therapeutic Goods Administration has allowed nurse practitioners and endorsed midwives to prescribe medical abortions since 2023, and this is a position supported by the Royal Australian and New Zealand College of Obstetricians and Gynecologists, Family Planning Australia, the New South Wales Nurses and Midwives Association, the Royal Australian College of General Practitioners, and the New South Wales Australian Medical Association. While other states and territories acted more swiftly to implement the TGA's position, New South Wales was lagging behind. With this landmark reform brought to the New South Wales Parliament by the Greens, we have a chance to finally catch up, to end the postcode lottery when it comes to people's ability to access abortions in this state. This week, members of Parliament who are listening closely to this debate and will be voting with a conscience when it comes to this issue will have received correspondence from Dr. Gillian Gibson, President of the Royal Australian and New Zealand College of Obstetricians and Gynecologists, reaffirming RANZCOG's support of expanding power to prescribe in this way and reiterating that this change will increase access in rural, regional and remote areas. And members would have seen the statement from the AMA New South Wales President, Dr. Catherine Austin, addressing misinformation circulating about this Greens abortion access bill and calling for respect of an evidence-based approach to this policy area. In debate on this bill in the other place, it was evident that there was some confusion about how expanding the power to prescribe medical abortions would impact on health practitioners' standards. To be perfectly clear, nothing in this bill would impact the existing extremely rigorous regulatory framework for healthcare practitioners, including the Poisons and Therapeutic Goods Act and the Medicines, Poisons and Therapeutic Goods Act. Nurses and midwives would only be able to prescribe medical abortions. They would not be able to perform surgical abortions to up to 22 weeks gestation, as some seem to fear and be spreading rumours that is the case. Indeed, to make it very, very clear, in the other place during the debate, an amendment was moved by the Honourable Penny Sharp in relation to that specific clause to reassure any members that this was not intended. And I read specifically and reassure members as per Schedule 1.3, Section 5.4, at point 5, nothing in this section, A, permits a prescribed health practitioner to act outside the practitioner's scope of practice, or B, affects a prescribed health practitioner's obligation to practice consistently with the practitioner's relevant professional standards, or C, affects the operation of the Poisons and Therapeutic Goods Act 1966, the Medicines, Poisons and Therapeutic Goods Act 2022, or any other law governing a prescribed health practitioner's practice. Surgical abortions would remain outside of their scope of practice, and appropriate action through the Healthcare Complaints Commission would remain available if practitioners acted beyond that scope. In debate in the other place, it also became clear that members from all sides of politics want more access to information in relation to abortion services being accessed in New South Wales. As such, Schedule 1, Clause 8 of the bill seeks to establish an annual reporting duty for the Secretary of the Ministry of Health that would require them to supply to the presiding officer of each house for tabling a report setting out 1, a description of abortion service availability by region, 2, detailed information about access to and waiting times for abortion services, 3, information about the clinical performance of abortion service delivery, including how safely and effectively abortion services were delivered, 4, information about any adverse events or clinical incidents reported in connection with terminations, and 5, information about the performance of terminations in the state by reference to the region and district. It is our hope that the information included in this report will be part of the broad evidence base used to inform ongoing work in this important policy space. There has been an enormous amount of misinformation about this bill, and therefore I would urge all members who are currently considering their position in relation to this bill to ensure that they look closely at the bill that is indeed being introduced in this chamber that we are debating here today. I caution members who may have a tendency to look at speeches made by those in the other place to make sure that they are speaking in this chamber to the bill before us, because there have been significant changes. Many amendments were made, and so it is critical that we debate the bill that is before us in this chamber and not prosecute arguments that others made in the other place about a bill that was indeed not the same bill as we have here. That said, as originally drafted, the bill did include a duty for the public health system to provide abortion services. The Greens know that this requirement did not need to be, and indeed does not need to be, strictly legislated. But we wanted to ensure that there was a requirement for the government to resource and support for public health care given as a priority and attention to be given to this. It is unacceptable that people are being turned away from public hospitals, whether it be in Queanbeyan and Orange, because these are not adequately equipped to provide abortions. And these are only the hospitals that we know about, because patients and health workers at Queanbeyan and Orange were courageous enough to tell their stories to the media. Our seeking to legislate for that provision was simply to require the government to provide the necessary services and the necessary access for people across New South Wales. We do not want to be in a situation, and indeed I acknowledge the Health Minister in the chamber, we don't want to be in a situation where we are relying on whistleblowers or traumatic situations experienced by individuals to go to the media about challenges they have facing when another public hospital, and then have a government having to intervene in that process. It cannot be a case-by-case basis. We need full funding for public abortion services in our public healthcare system across the state. Primary care and non-government providers, including family planning and many others, do absolutely outstanding work to ensure the community can access their right to choose, but they cannot be the only solution. Last November, in question time, the Premier, I was very welcome to see, affirmed his government's commitment to providing transparent and safe avenues for abortion care in New South Wales. This was in response to me asking what the New South Wales Labor government was doing to ensure full access to abortion and all reproductive healthcare services in the public health system. The Premier, in response to that question, said, "Members would be aware that in most cases, medical or surgical abortions are provided in primary care or private practice settings, but of course we recognise that the public hospital network has a role to play here. That will be fully funded and the services will be available." While this is very welcome that this is the Premier's position, and we thank him for it, it is all well and good to say this, but we also know that ensuring fully funded, readily available abortion services in the public system, sadly at the moment, is simply not a reality. This is why we wanted the weight of the legislation to ensure that this was the case. That said, that provision is no longer in the bill that we are debating here, but it does not prevent, indeed, the Minister for Health or government members contributing to the debate on this bill to put on the record once more their commitment to ensuring that this is the case. And in turn, I will give you the Greens' commitment that we will continue to hold the government to account for this promise so that we can see it delivered for people across New South Wales. I want to acknowledge that this bill and debate are only possible because of generations of reproductive justice activists, feminists, people who have campaigned for a woman's right to choose, for people to have access to safe reproductive health care who have gone before us, who have fearlessly fought for our right to choose. In 2019, when the member for Sydney introduced the Reproductive Health Care Reform Bill, I was proud to join my colleague in the other place, Abigail Boyd, as co-sponsors on behalf of the Greens, alongside the members for Blue Mountains, Kira, Summer Hill, Maitland, North Shore and Lake Macquarie, and the former members for the South Coast, Wakehurst and Port Macquarie, as well as members from the other place, Penny Sharp, Emma and Trevor Khan. Even in 2025, abortion access remains a hotly contested issue, and we have a long way to go before it is finally treated wholly and uncontroversially like the matter of basic health care that it is. In 2022, when we saw the US face a major reversal in reproductive rights with the overturning of Roe v. Wade, we saw Australians turn up in their thousands in the pouring rain on George Street to say loudly and clearly that we will not go back. We will not allow for right-wing organising groups to take away our right to access essential reproductive health care, and we will keep being loud and keep fighting to ensure that all those who need to access abortion care are able to do so, regardless of their postcode. This bill is an essential expansion of access for people to health care. access to their reproductive rights at a time when we are seeing abortion bans imposed in several states in the US and organised campaigns of harmful disinformation that has caused considerable stress in our own communities. Now, whenever we debate legislation where the government and the opposition are granted a conscience vote, we know that much of the debate will contain personal stories. It will contain details about members' personal views, their experiences in relation to these views, and indeed their values and their experiences of what has shaped their position. Now, I am incredibly proud and pleased to be part of a party that doesn't grant a conscience vote on such matters, because I strongly believe that it should be the conscience of the person who is choosing whether or not to have an abortion that should guide their decision, not those of us in the chamber who don't even know them, to allow our conscience to dictate what choice they have to make. That said, and given many members will currently be weighing up their own personal views and beliefs, and indeed preparing to share their personal stories, I believe it is only fitting for me to do the same. At the age of 20, I was in London. I would never have imagined that at that age I would now be standing in this chamber debating this kind of law reform. I was working in a cocktail bar in Soho and about halfway through a year-long backpacking adventure. Having a child was not on my radar, and it was certainly not what I intended or wanted. So when I found out that I was pregnant, it was clear to me straight away that I didn't want to go through with it, that I wanted to have an abortion. I decided to have an abortion. Unfortunately, my first step in trying to do this involved a very unhelpful and insensitive GP who was clearly unhappy with my desire not to become a mother at the age of 20 and didn't hide his anti-choice agenda from me. Thankfully, after that unpleasant, confronting and hurtful experience, let's just say having someone undertake an external examination of you and then undermining your autonomy to make a decision about your own body or your own future is fairly degrading, I found myself thankfully connected with an NHS clinic, a public clinic, and supported by healthcare professionals who gave me the option of taking a pill and looked after me during the relatively pain and stress-free medical termination procedure. I've talked publicly on the record before when we talk about the choice and access to healthcare, and particularly reproductive healthcare, that I in fact found the birth of my daughter a hell of a lot more traumatic than I did having this termination at the age of 20. It was a simple procedure. I was supported by a very good and public healthcare system that assisted me. That is how public healthcare should work. For so many in New South Wales, despite us decriminalising abortion, this is sadly not how it works. And as someone who is able to be the beneficiary of this kind of care at the age of 20 and this kind of healthcare, I hope with support of members across this divide that we are able to take the step to make this trauma-free option available to others, to make it easy for people to be able to make choices that are right for them and not stand in their way. I think it is also fitting that a regional Greens MP, Dr. Amanda Conn, started the passage of the bill in this place, and that I, a very, very inner-city Greens MP, continues the struggle in this place. Because what this bill is ultimately seeking to do is to remove the disadvantage and increase the access to those who, due to geographic, socioeconomic and other reasons, are not able to access abortion care. It is much less of an issue for the constituents that I represent. But it should not be a lottery of a postcode that determines who gets access to this healthcare. To those members listening to this and feeling unsure about the prospect of supporting a Greens bill, I want to reassure you by making it clear that many organisations and groups are in support of this reform. Indeed, I want to remind you that New South Wales Health made a similar recommendation in recent times. I want to read you, if I can briefly, the letter provided by RANZCOG in support of the Healthcare Access Bill. It clearly states that RANZCOG supports equitable access to sexual and reproductive health care, including abortion. Women should be able to access the method of abortion most appropriate to their clinical circumstances, informed by their values and preferences, and free from coercion. Health professionals have a duty to provide evidence-based, unbiased information that supports informed consent and shared decision-making. It's absolutely critical that we recognise that there are medical professionals, the people that are on the front lines of providing healthcare across this state, who are supportive of this reform. It's also absolutely critical that we remember that if we do not increase access for people in this state, that there is a genuine risk that there will be more harm done. Harm done and trauma caused to not just the health professionals that are finding themselves unable to deliver the services that they wish to do, that they're trained to do, but also the impact that it will have on so many people who are unable to access this critical healthcare. The Greens have always known that rights can be granted and revoked through legislation, that they are never set in stone, and that it is our responsibility to stand with women's and reproductive rights activists pushing hard to ensure that our rights are accessible and not rolled back. I urge members of this place to support this bill, and should they have any questions during the course of the debate, I encourage them to come and speak to me and my Greens colleague, Dr. Amanda Conn, who are here and available to speak to them in any further detail.
I call the Minister.